T-1 day afternoon. Welcome back to the second half of our crucial preparation day in the Colonoscopy Preparation Podcast series. I am Bimal Maharzan, and this afternoon, T-1 afternoon episode, we are diving deep into the practical steps of starting your colonoscopy prep. This phase is key to ensuring a clean and clear colon, so your doctor can have the best possible view during the procedure. However, please remember, while GovSphere provides self-help GI care tools and resources, we are not a healthcare provider or a clinical firm. Our content is designed to empower you in managing your gastrointestinal intestinal health, complementing, not replacing, professional medical advice and treatment. Always consult with a healthcare professional for medical concerns. Our guide today is grounded in latest recommendations from gastroenterology experts and is designed to make your prep as effective and as bearable as possible. We combine medical guidelines with practical tips from patients and my personal experience who have navigated this journey successfully. Today's episode, we focused on adhering to a clear liquid diet, managing medications, and preparing mentally and physically for today's prep start. We discussed the importance of hydration and maintaining energy levels without compromising your diet restrictions. As always, our series follows a medically planned timeline, guiding you through each step towards your colonoscopy. The T-1 afternoon episode is a pivotal part of this journey, where you begin the actual bowel preparation that is crucial for a successful colonoscopy. In today's episode, we will cover everything from how to correctly mix and consume the prep solutions to managing hunger and potential side effects. We'll provide detailed instructions on the timing of the prep and how to deal with common and severe reactions you might encounter. For those with chronic conditions, we'll discuss special considerations to keep you in mind as you go through this process. Stick with us. By the end of this episode, you will feel fully prepared to tackle the prep with confidence and peace of mind. We are here to support you through every sip and step, ensuring that you head into your colonoscopy with the best possible preparation. Before we move ahead with starting the prep, let me quickly recap different types of prep solutions. Today, we'll break down the options into categories, exploring their mechanisms, and discuss the pros and cons of each. Our goal is to demystify this crucial part of your procedure prep. We have discussed in depth in T-14 days episode, picking up the prep. In this episode, as you are going to take the prep, I think it's important to highlight the different categories of prep solutions. So in general, there are five categories. Number one is polyethylene glycol PG solutions. Number two is low volume magnesium based solutions. Number three is sodium picosulfate based solutions. Number four is tablets form preparations. And number five is various other miscellaneous solutions. First off, we have polyethylene glycol PEG solutions. These are isotonic solutions that require a significant amount of liquid to effectively cleanse the colon. They work by drawing the fluids into the bowel and helping to flush out everything in their path. Some of the examples are Go Lightly is the go-to choice for those needing a thorough cleanse and can handle large volumes. Miralax, often mixed with Gatorade, offers a more palatable option with additional electrolytes for better hydration and taste. New Lightly comes with flavored packs to enhance the taste, making large volume more bearable. Clean Prep is similar to Go Lightly and widely available in several countries. Second, moving on to low volume magnesium based solutions. which are designed for ease with essential electrolytes to prevent imbalances. Suprep requires only 16 ounces of solution at a time, ideal for those who prefer lower volumes. Plainview requires just 1 liter, but it's a bit pricier, though effective for a less burdensome prep. CleanPick, the easiest of the bunch, comes with a very small volumes, but watch out for potential cramping. Third, for those looking for stimulant options, sodium picosulfate-based solutions include a stool softener to make the process smoother. CleanPick and Picolax are great choices here, especially for those who need a low volume options that easy on the stomach. Fourth, and for those who prefer not to drink their prep, tablet forms preparations like OsmoPrep offer an alternative, though be mindful of the potential for kidney issues. Fifth, we also have some miscellaneous solutions that don't fit nearly into one category but are important options depending on specific needs. Movie prep improves on taste and requires less fluid than high volume solutions, though it might cause some bloating. Bisacodyl dulcolax is often used alongside other preps to ensure effectiveness, but watch out for cramping. Miralax mixed with Gatorade, while not FDA approved for this use, is well tolerated and popular off-label brand. Clean Prep and Bipeg round out our list with effective cleansing capabilities and added electrolytes for those who need a lower volume options. So here is a quick pro and cons of different types of prep solutions. Polyethylene glycol solutions. The pros is highly effective at cleansing the colon thoroughly, generally well tolerated by the majority of patients. The con is requires consuming a large volume of liquid, which can be challenging and uncomfortable for some patients. Low volume magnesium based solutions. The pros is less liquid to consume, making the prep easier to handle, include electrolytes to maintain balance. The con is can be more expensive than other options. Some may cause nausea and dehydration due to their potency. For example, I use Suprep. Sodium picosulfate-based solutions. The pros, typically lower in volume and includes a stool softener, making the process more comfortable. The con is not suitable for everyone. Some patients may experience quicker onset of action, which can be inconvenient. Tablet form preparations. Pros, convenient for those who have difficulty consuming large volume of liquids. It's portable and easy to administer. The con is the associated risks such as potential kidney damage, not suitable for patients with certain pre-existing conditions. Miscellaneous solutions. The pros is include options for patients with specific taste or who need a gentle approach, often used off-label successfully. The con is some may not be FDA approved, especially for colonoscopy prep, and is potential for various side effects depending on the ingredients. Now, let's talk about starting the prep and prep instructions. And we will follow a quick Q&A format for this. And let's start with the question. Can you provide step-by-step instructions for taking the prep solutions? Here is the detailed step-by-step instructions for using each type of colonoscopy prep solutions, starting with the categories that we have discussed. Number one is polyethylene glycol PEG solutions. Example is go lightly. First, mix the solution. Pour the powder into a provided container, add lukewarm water to fill the line, typically 4 liters, and stir until the solution is dissolved. And chilling is optional. Many find the solution more palatable when chilled, refrigerated for a few hours before starting. And third is drink. Consume an 8-ounce glass of a solution every 10 minutes until the container is empty or bowel movements are clear. And fourth is complete the intake. It's crucial to drink all the solution unless advised otherwise by a healthcare provider to ensure a thorough cleanse. And another example instruction for Miralax mixed with Gatorade. Number one is mix. Combine the entire bottle of Miralax with 64 ounces of Gatorade in a large container. Shake well until the powder is fully dissolved. And second, drink. Drink an 8 ounce glass of mix every 15 minutes until the mixture is finished. Third, continue clear liquids. Keep drinking clear liquids until bowel movements are clear. Now, second category, low volume magnesium based solutions. The example for Suprep. Prepare for the first dose. Pour 1 bottle of Suprep into a mixing container and add water to 16-ounce line and mix. And second, drink the first dose. Drink the entire mixture, then drink 2 more 16 ounces glasses of water over the next hour. Third, repeat for second dose. Depending on your doctor's instruction, prepare and consume the second bottle Suprep evening before the colonoscopy prep or the morning of the procedure following the same steps. Another example is Plainview. Again, mix the first dose, pour 1 pouch into the container and water to fill the line, stir until dissolved. Second, drink the first dose, consume the solution over 30 minutes, follow with additional clear liquids as directed. Third, prepare and consume the second dose. Mix the second pouch as directed time, usually on the morning of the procedure, and drink it followed by more clear liquids. Sodium picosulfate-based solutions. Example, Cleanpick. First, chill. This is optional. Cool the bottles in the refrigerator for better taste. Drink each bottle. Drink the content of the first bottle, followed by at least 5 8 ounces glasses of clear liquids. Drink the second bottle at the directed time with an equivalent amount of clear liquids. Continue clear liquids. Keep consuming clear liquids until the bowel movements are clear and are free of solids. Tablet form preparations. Example, Osmoprep. Initial dose. Take 4 tablets with 8 ounces of clear liquid every 15 minutes for a total of 20 tablets. Second dose. Depending on your schedule, take an additional set of tablets, usually 12, the evening before or morning of your procedure, following the same 15-minute intervals with the clear liquids. Hydration. It is crucial to stay hydrated throughout the process to avoid kidney issues and ensure effective cleansing. After this step-by-step instructions, let me answer other frequently asked questions. And the question is, should the entire solution be consumed even if my bowel movements are clear before it's finished? It is generally recommended to consume the entire solution as prescribed by your healthcare provider, even if bowel movements have become clear before all the solutions has been consumed. Because of 2 reasons. Number one, complete cleansing. The full volume of PrEP solution is calculated to ensure the entire colon is cleansed thoroughly. Incomplete consumption could leave behind waste in parts of colon not yet reached by the solution, potentially obscuring the visibility during the colonoscopy. For example, a study in the Journey of Gastrointestinal and Liver Disease noted that patients who consumed the full PrEP solution had a significant lower incidence of incomplete exams due to the inadequate bowel preparations. Second, clinical guidelines. Most guidelines and instructions from PrEP solutions manufacturers specify the importance of completing the entire doses as directed to achieve the desired outcome of preparation. For example, the guidelines from the American College of Gastroenterology emphasize completing the PrEP to improve the likeliness of successful and thorough examination, thereby reducing the risk of needing repeat procedures. So, while it might be tempting to stop consuming the PrEP solution once clear bowel movements are achieved, Complete the entire prescribed volume is crucial for effectiveness of your colonoscopy. As always, follow your healthcare provider's instructions closely and consult with them if you have any concerns about completing PrEP. This ensures that doctor has your best possible visibility, which is essential for accurate diagnosis and treatment. Let's move on to another question about timing and consumption. Exactly when should I start drinking the PrEP solution and how quickly should I drink it? Timing and pace are crucial factors in the effectiveness of your colonoscopy PrEP solutions. Knowing when to start and how to quickly drink the solution can significantly impact the preparation's success. Let me make two key points. One, starting time. The exact starting time for drinking your PrEP solution often depends on time scheduled for your colonoscopy. Generally, you should begin the PrEP process the evening before your procedure around 5 p.m. to 7 p.m. For example, if your colonoscopy is scheduled for the morning, starting the PrEP in the late afternoon or early evening allows enough time for the solution to work through the night, ensuring your colon is clean. Number two, consumption pace. It is recommended to drink the solution at a steady but a manageable pace. For example, such as Go Lightly or Movie Prep, you should drink an 8-ounce glass of mixture every 10 to 15 minutes until the solution is finished. So, the evidence show that steady intake over a short duration rather than drinking too quickly or too slowly provides the best balance between effectiveness and tolerability. Drinking too quickly can increase discomfort and side effects such as nausea and bloating, while drinking too slowly may reduce the effectiveness of the bowel cleansing. In summary, you should start drinking your colonoscopy prep solution on the evening before your procedure and consume it at a pace that allows you to finish the prescribed amount without discomfort. Always follow the specific instructions provided with your prep kit or by your healthcare provider to ensure the optimal results. This preparation step is key to successful colonoscopy, allowing your gastroenterologist to perform a thorough and effective examination. Let's move on to another dietary concerns. Am I allowed to anything at all during the afternoon before starting a prep, or should I have already started fasting? So understanding dietary restrictions on the day of your colonoscopy prep is crucial for ensuring the effectiveness of the procedure. So I'll make two key points, one on dietary restrictions, second on the rationale for fasting. On the day you start your colonoscopy prep, it is generally recommended to avoid solid foods, and T-1 is a clear liquid diet, so no solid foods. The reason why is it allows the prep solution to work effectively, ensure a clear view for the examination. For example, instead of solid foods, be on a clear liquid diet such as tea, broth, clear juices without pulp up until a few hours before consuming the prep solutions. And here is the rationale for fasting. Research and clinical guidelines suggest that fasting from solid food at least 12 hours before the bowel prep reduces the risk of complications such as aspirations and ensures the colon is clean. In conclusion, you should not eat any solid foods during afternoon before starting the prep. Sticking to clear liquid diets not only complies with medical advice, but also maximizes the effectiveness of the cleansing process. And obviously, you will get hungry. So, what are some of the tips managing hunger or feeling of hunger on the clear liquid diet during the prep process? And especially when your bowel is complete, your entire digestive tract is empty, most likely you'll feel hungry, and how to manage them. So I'll make three key points. Number one is frequent small drinks. So consuming clear liquids frequently but in small amounts can help starve off hunger without filling the stomach too much. This approach keeps you hydrated and somehow satiated. For example, sipping on clear blood broths, tea, or water throughout the day can help manage the hunger pangs without compromising the prep's effectiveness. 2. Distracting activities. Just be busy. Engaging in a light activity such as reading, watching TV, or light working can distract from the feeling of hungers. Mental engagement helps divert attention from the stomach to the activity at hand. For example, when you are so busy, we forget to eat. The same thing applies. Our mental attention span is focused on something else. And I think the same tip is applicable here as well. For example, if you keep thinking too much about the food, then obviously you will get hunger. And sometimes you're busy watching a TV or a movie or series or having a conversation with a friend or family member that can divert away from the focus on the hunger and help you beat the hunger during this clear liquid diet day and preparation day. Third, maybe you can use approved gums and candies. Some physicians allow the use of clear, non-colored hard candy or gum to manage hunger, as long as these do not contain dyes or are not red or purple. The reason why you should avoid anything red or purple is it can mimic the appearance of blood in the digestive tract. So, to effectively manage hunger during colonoscopy prep, it's beneficial to plan your clear liquid intake throughout the day. Just don't gulp it down at once, sip by sip throughout the day. It's like jogging, not it's like because it's a marathon, it's not a sprint. So sip by sip and stay engaged in distracting activities. And maybe you can use small approved items such as gums or candies if permitted. And obviously, you always have to consult with your healthcare provider for a guidance for your tailored specific health needs and preparation instructions. And some of us may have side effects such as bloating, cramping, and also exacerbation of other symptoms. So, how to deal with side effects? And what are the most common side effects that one might experience from PrEP solutions, and how can one manage them? So, common side effects are the most typical side effects include nausea, bloating, abdominal cramps, and frequent bowel movements. Less commonly, some people may experience headaches and fatigue. And in order to manage those symptoms, there are three strategies or four strategies. Number one is hydration. Obviously, drink plenty of clear liquids to stay hydrated, as dehydration can exacerbate the side effects. Electrolyte balance. Incorporate a clear electrolyte solutions to help maintain balance, especially after multiple bowel movements. For example, it causes diarrhea, and one of the things you're prescribed during diarrhea is ORS. So you can take ORS, especially when it's very clean and it can help balance electrolyte. Comfort measures. If you use a heating pad for abdominal discomfort and ensure that you have easy access to the bathroom. 5. Pacing your intake. Drink the PrEP solution as a pace that is comfortable for you, which can help minimize nausea and cramping. So, with these four strategies, hydration, electrolyte balance, comfort measures, and pacing your intake should help you manage your side effects. The reason, the rationale and support for these strategies is the clinical studies show that proper hydration and electrolyte management can significantly reduce discomfort and improve the overall tolerability of the PrEP process. So, in conclusion, by staying hydration, pacing your intake of a PrEP solution, using simple comfort measures, you can effectively manage the common side effects associated with colonoscopy preparations. So, these simple strategies for most people will be absolutely helpful. For some people, they may be severe reaction. So the question is, what should I do if I experience severe nausea, vomiting, or an inability to keep the solution down? While most side effects of colonoscopy prep are manageable, it's important to know how to handle severe reactions should they occur. So I will make three key points. Number one is identifying severe reactions. Reactions include persistent vomiting, inability to keep down the solution, significant dizziness, or signs of dehydration such as very dark urine or inability to urinate. Number two is immediate actions. If you experience severe nausea or cannot keep the solution down, you should pause intake, stop drinking the prep temporarily and rest. Second, hydration. Try sipping small amounts of clear liquids or sucking on ice chips to stay hydrated. And third, medications. Consult with your healthcare provider about possibly taking an anti-nausea medication if not contraindicated. And third point is about when to seek help. So advice to you is contact your healthcare provider immediately if your severe symptoms persist. In case of severe dehydration or continuous vomiting, seek emergency medical attention to prevent further complication. Medical intervention is necessary when standard management strategies fail to control symptoms, as continuing with an inadequate prep or suffering severe dehydration can lead to potential cancellations and complications. So, severe reactions to colonoscopy prep are rare but require prompt attention. Knowing when to pause the preparation, when to seek medical advice is crucial for your safety and the success of the procedure. Always have a plan in place for a quick communication with your healthcare provider during the prep solution. Now, another very important question is about hydration. How can I ensure I stay adequately hydrated while taking the PrEP solution, especially if I'm experiencing frequent bowel movements? So, hydration techniques and monitoring hydration. So, let me talk about hydration techniques. Three things. One, sip on clear salt liquids. Have been re-emphasized again and again. Drink clear liquids, water, broth, electrolyte solution throughout the PrEP period to replace the fluids lost through diarrhea. Avoid diuretics. Stay away from beverages that can dehydrate you, such as caffeine and alcohol. Third, frequency and amount. Aim to drink at least 8 ounces of clear liquid every hour while awake during the prep process. Two, monitoring hydration. Okay, check urine. Your urine should be light in color. Dark urine is a sign of dehydration. And symptoms to watch. Be aware of symptoms such as lightheadedness, dizziness, or dry mouth, which could indicate dehydration. So, maintaining adequate hydration is crucial for a safe and effective colonoscopy prep. Regular intake of clear liquids and monitoring for dehydration symptoms can help manage the fluid loss associated with prep solutions. So we have talked about medications and chronic conditions in T minus 7 days, T minus 5 days, and we have been sprinkling information in every episode of it because it's absolutely important to manage your chronic conditions and medications. So let me go through the medications and chronic conditions once again. The question is, can I still take my regular medications after starting the prep, especially if I take them in the evening? So take regular medications as close to as possible to your usual timing, but with a sip of water. Consult with your healthcare provider for medication that might need to be adjusted or withheld. Some medications, especially we talk about in detail, blood thinners and diabetic medications may require specific time adjustments. Furthermore, are there any additional precautions I need to take if I have a chronic condition such as diabetes when starting PrEP? So for chronic condition management, for diabetes, monitor blood glucose level more frequently during the PrEP, as fasting and fluid intake can affect blood sugar levels. Adjust insulin or diabetes medication as advised by your healthcare provider. And for heart disease and others, patients with heart conditions or other sensitive disorders should consult their doctors about any specific precautions related to electrolyte imbalance and medication adjustments. Obviously, with related to medications and other chronic diseases, we hope that you are more empowered and educated to ask the questions with the healthcare providers. Let them know that all the comorbidities or any chronic conditions you have so that they can give you a very tailored and personalized advice. And even the doctors will love you for that because even they want to answer the questions and make you feel at ease and any questions that you have and they'll be happy to answer. So because it also improves their efficiency and the better you are prepared, the more efficient the process is going to be, and also just purely administrative ways as well. If you are ill prepared, if you show up inadequate preparation, and you have because of the medications, for example, some people continue taking the blood thinners in the very last moment. I don't think they will. Your doctors will be continuing the procedure because if they have to remove polyps and again the risk of excessive bleeding may there and they'll have to reschedule it and that is inconvenient and costly for everyone. So therefore, if you're empowered and educated to ask the right questions, even your doctors will enjoy answering them because it improves their efficiency and also you are well prepared for it. Furthermore, I understand that this is a procedure you don't go often. So their anxiety and some psychological emotional stress is common. I was anxious about this because it's uncommon for someone to insert a and pipe through a bottom and be a patient and go to the hospital. You can just going to the hospital is overwhelming, changing the gown, picking and poking, that can add additional stress. But again, colonoscopy is fairly, I think, very, very fairly safe process. Again, it's a precautionary process. It's important to be done. Then, if the during a trade-off, the benefit outweighs the risk, you must do it. And understanding that alone is going to give very comfort. It's a risk benefit analysis, and the benefits outweigh the risk. So in that scenario, I think it's a little bit of trouble, little bit of uh, inconvenience for a day or two if everything goes properly. So that's the reason why we are creating this guidance as well, so that you can do it with ease, with peace of mind, with confidence, without any complications, both for you as a patient and if you are taking care of somebody else as a family member or a friend, for as a caregiver, it gives you peace of mind. And third, providers, like it adds a lot of efficiency to you because patients come prepared and uh, there is less cancellation, less rescheduling, and obviously the better diagnosis because of the clean bowel prep and obviously better treatment plan because it increases the probability of the patient adhering to the treatment plan as well. So empowered patient, educated patient is beneficial for everyone. Now let me talk to a bit about psychological and emotional support. The question is, what strategies can I use to cope with anxiety or discomfort associated with taking the PrEP solution? First of all, choose the PrEP solution that's right for you. I've listed different kinds of PrEP categories of PrEP solution. You can walk through with a doctor, and with your conversation, you can choose the right one. That can reduce the anxiety. For example, if you can't drink a lot of water, there are low volume options available. There are tablets available, so you can potentially personalize the best fit for you. Again, for two more key points I will make about anxiety, discomfort management, and preparation and environment. So in anxiety and discomfort management, again, three things. Number one is relaxation techniques, distractions, and support system. In relaxation techniques, there is deep breathing, progressing muscle relaxation, or meditation to alleviate anxiety. So for distractions, engage in light activities like reading, watching television, or listening to music to distract the discomfort. So what I did was I watched TV. Was a series. So I was sipping the water, drinking water, staying close to the bathroom. Again, whenever there was a urge for bowel movement, rush to the rush to the bathroom, toilet, clean the bowel, and come back and watch so that I'm distracted, I'm relaxed, and I'm at home. So that helps. Supports the third is support system. Communicate with friends or family about your feelings. Having someone to talk to can provide significant emotional support. Yep. For me, I had my wife with me, so I could talk to her and she would comfort me if I'm anxious. So again, having that support system is extremely useful. You can call someone or you can have someone be at your place and that could help you reduce anxiety and discomfort. And second category about preparation and environment, comfortable setting. So prepare your environment with comfort in mind, such as having comfortable seating area near the bathroom and soft lighting and information preparedness. So understand the steps of the prep process, knowing what to expect can reduce anxiety. Most of the time people have anxiety because about uncertainty and unknown. And where is certainty and known things, the anxiety reduces completely. Therefore, what's the gap between unknown and unknown is the education. And hopefully this education is providing you everything that detail that one needs to know so that when and there is less uncertainty and more certainty, and that more certainty and known knowledge can help you reduce anxiety and provide you comfort. And that's what I did. So I went through all process, followed every step very properly. So I was thinking, okay, I I am here right now is going to be what the next process is going to be, preparation. So I was aware of that, and that helped me reduce my anxiety and provide me with comfort. So managing psychological stress during colonoscopy prep is crucial. So using effective coping strategy and ensuring a supportive environment can help you navigate the process more comfortably. If anxiety or discomfort becomes overwhelming, do not hesitate to seek further support from your healthcare provider. And let's also talk about logistics and planning. I think logistics are important. At the end of the day, you don't reach to the facility, you don't facility, then you don't get to the procedure. So I think let's go through a few questions about logistic and planning. The question is, how should I prepare my home or bathroom to make the process as comfortable as possible? I think I'll add three things. Number one is access to facilities. So ensure easy access to bathroom. So consider temporary adjustment like additional night lights for safe navigation at night. So number two is comfort measures. Set up comfortable area with necessary supplies like toilet paper, wet wipes, and skin soothing products to maintain irritation. Third is entertainment. Prepare books, magazine, or tablet with movies and shows to help pass time during the extended bathroom stays. And we have reached to another very important step we think about sleep. So sometimes we wonder, we go because of the bowel movements, frequent bowel movements, will it hinder sleep? I think it's a valid concern. And let me help you answer that. So the question the most people have is, given that I will be preparing for the colonoscopy and starting the prep this afternoon, how can I manage sleep if I need to wake up frequently during the night? So three things I would say. Plan ahead. You might need to wake up frequently to use the bathroom. Try to rest or nap earlier in the day before starting the prep. So comfortable bedding. Use waterproof mattress protectors and have extra seats, blankets handy in case of accidents. Accidents can happen because after this, the the prep materials are laxatives, right? And laxatives work because they want to give you urge for the bowel movement, and it's artificial trigger to clean the bowel movement. So in that, for some people, the accidents can happen. So in that scenario, it's better to be safe and uh, and keep those things in handy in case of accidents. But it's mostly unlikely. I didn't have that. Those accidents were mostly unlikely, but some people cannot get up quickly, move quickly, and mobility is slow. So in those kind of cases, this uh, these will become handy. So another third is alarms. Set alarms at intervals if you need reminders to take a subsequent doses of the PrEP solution or to monitor your condition. Exactly. These reminders are crucial as well. Sometimes we forget. And colonoscopy is not something that we do every day. It's not part of our habit cycle. Therefore, it's normal for us to forget things. Hence, we recognize this human nature and we don't blame anyone for this. I think it's absolutely normal for us to forget with things which are not part of our daily routine. Therefore, we what we have also done is we have also come up with the colonoscopy prep reminders, and we'll be launching that soon. Along with this colonoscopy podcast, we also have resources such as user guide and checklist. Furthermore, what we have is we have colonoscopy prep reminders where you could at gutsphere.com/colonoscopy prep reminders where you can sign up for the reminders and we will send you the timely reminders starting from T welcome guide to T minus 14, T minus 7, T minus 5, T minus 3, T minus 1, T minus 1 morning, afternoon, and evening, and before the arrival and recovery and the long-term management. So we are going to send you the right reminder at the right time with the right instructions. And the most importantly, we will send you in the language the patient understands. We also understand that not everybody understands English. For in the United States, their language is Chinese, Hindi, Spanish. Those are important as well. And also as some minority languages such as Swahili and other minority languages are important to provide access. So we'll have those reminders, instructions with many languages as possible. So if you need reminders, please go and sign up in GodSphere colonoscopy SMS reminders. Again, it's SMS. So even if you don't have a smartphone or the patient don't have a smartphone, you can sign up for you can sign up. And again, who can sign up? Obviously, the patient can sign off the reminders for themselves. That's one. Second is caregivers can sign up on the behalf of patients. For example, if you are a daughter or son, your parents are scheduled for colonoscopy and they need the reminders, you can sign up for them and they'll start receiving reminders at the right time. It will give you a peace of mind that somebody is reminding them to follow the right procedure at the right time. And third is the nurses or clinicians at the clinics or hospitals who can sign up on the behalf of patients so that patients comes prepared and from come prepared. So we will talk more about this SMS prep reminders more, but however, you can find more details in gutsphere.com website. So website is www.gutsphere.com. And moving back to our podcast, we're almost at the end of the podcast. And one reminder I would talk about is I will request you to check in. And the question is, should I report back to my healthcare provider once I have started the PrEP only if I encounter issues? So when to communicate? So in two cases, routine updates. It's a good practice to report the start of your PrEP to your healthcare provider, especially if you have pre-existing conditions or are taking critical medications. And when encountering issues, immediately report any severe reactions, inability to tolerate the solution, or if you have any questions about unusual symptoms. So don't hesitate to pick up the phone and call, have that hotline number or the provider's number handy. Please call them if you have any questions or if you have any complications immediately. Never take chance. But most likely that conditions will be rare. And for routine updates, maybe your healthcare provider have uh, some app or some SMS that you can report to so that you can do it quickly, but you don't have to call and wait in the queue for hours. So again, you can communicate during routine updates if the health your provider have asked for it, or if you want to just send the update, or definitely communicate when you have encountered a severe reaction. So, so it, and then how to communicate? Obviously, two ways: pre-arranged contact. Use contact numbers provided by a healthcare provider's office for updates or concerns. They may have specific instruction how to report progress or issues. Second is documentation. Keep notes on your prep progress and try reactions or side effects, as this information can be crucial if your healthcare team to provide appropriate advice or intervention. That's exactly why we have added these two resources. The T-1 afternoon colonoscopy preparation guide, where you have in a very tabular format, easy to refer to. So it has time, activity, instructions, and notes. And this accompanies the checklist where you can record the activities you have done and take notes. And if you have, again, this checklist becomes the uh, integral part of the documentation, and you can use this documentation to communicate with your provider in case you need to communicate with them. And obviously, I want to reiterate three additional points. One, emergency contact. Two, confirm your transportation arrangement for the day of the procedure. And again, plan relaxation activities. Plan activities to help you relax and stay calm, such as watching a movie or listening to music. And again, I would reiterate the instruction for use. So before starting, review the entire checklist and instruction provided by your healthcare provider. During the PAPE, check off each task as completed, add notes for any additional concerns or deviations. And three, post-prep, review the checklist to ensure all tasks are completed. If any issues arise, contact your healthcare provider. So this worksheet can be printed and kept handy during the preparation to ensure that each step is followed meticulously and any concerns are promptly addressed. And now we reach to the conclusion of T-1 afternoon episode. As we wrap up this T-1 afternoon session on colonoscopy preparation, thank you for joining us through these essential steps of starting your bowel prep. Today, we have covered everything from the types of prep solutions to practical tips on how to consume them effectively. We have discussed the importance of timing, managing side effects, and how to ensure your preparation area to set up for comfort and accessibility. This T-1 afternoon was all about making sure you are well prepared for the next crucial hours. We tackled how to manage your hydration, how to adjust medications if you have chronic conditions, and ways to cope with any anxiety or discomfort that might arise during the prep solution. As you continue with your prep, we'll move on to the final stages before your colonoscopy. The T-1 evening episode will guide you through completing your bowel prep, ensuring you are ready for the procedure the following morning or the day. We'll provide the detailed guidance on what to expect as you finish the prep, how to manage sleep despite frequent bathroom trips, and last minute checks to make sure everything is in order. Stay tuned and remember, the goal of this preparation is to ensure that your colonoscopy goes as smoothly as possible, providing clear results for your health. So keep up the great work, follow up the steps that we have outlined, the prep solutions have outlined, and healthcare provider have outlined. You will be well on your way to a successful procedure. See you in T-1 evening for the next vital steps. And final reminder, don't forget to check our user guide and checklist for detailed instructions to track your progress. As always, if you encounter any issues or have questions, reach out to your healthcare provider immediately. Thank you for your dedication to your health, and I look forward to guiding you through the next phase of preparation in the T-1 evening episode. Thank you. Bye.